In the early stages of hybrid implant cases, we did a lot of full contour zirconia cases that had all on 4 implants or all on 6 implants, and we extended it out to the first molar. A lot of the problems we had with those restorations is that we had fracturing very easily in that zirconia. So this is a material now that we can replace those substructures of zirconia hybrids and be able to make our substructures with PEEK material that gives much better elasticity and durability, as well as a shock absorption effect. So I've got a crown here that I've got made. This is a case that I've done PMMA crowns on top of the PEEK JUVORA material. And I've got everything bonded except this lateral, so I thought I would go ahead and bond this on film so that you could see this. Again, we've got the process already set up as its preparations on top of the PEEK material, and we've made crowns to go on top of those preparations. Then after the crowns are made, we will layer with a pink composite material and cure that with a resin light system, and I'll do a little bit of that right now. I happen to be using multi-link from Ivoclar. So the key to that solution is it must be used with a adhesive or a primer. And in this particular system, it has an A and B system, and you use it 1-to-1. So I will use 2 drops of material on each one, mix that together, and I will lay that on top of, as I mix it, I will lay that on top of my preparation very thinly. I'll do it with the first brush to get a good layer on top of the preparation. I'll do the same thing inside of the crown. So when I get it inside of the crown and on the prep, I'll set it down, take my second brush to wipe any of the excess off so that I don't have it pool up at the marginal area and cause an ill fit. So now, if I give it about 5 minutes to cure, which I won't give it 5 minutes in this presentation, but if I give it 5 minutes to cure, it will be set up and ready to adhere to the composite material. This is very important because without this, I will tell you, most certainly you will have debonding. So I want to make sure that everybody on this that sees this understands that the bonding material is extremely important with this process. Then after you get the bonding material on, you want to use your cement inside of the crown. And not so liberal, but enough to where it will actually cover the crown and give you that area of adheration to the entire unit. And now we've got this crown bonded down to the system. Any excess that's on there, I'll go ahead and scoop off that comes out from outside. Scoop off on both sides around there to get any excess. Then I'll use my curing light, and I hope this doesn't blind you, but I'll use my curing light to get an initial cure through the material. Most of the materials we're using for finishing on JUVORA would be Emax or any of the pressable materials that are lithium disilicate or lithium silicate. We could also use zirconia layered ceramics or even zirconia, monolithic zirconia. But in this case in particular, I've got PMMA crowns on this that are very cosmetic, and gives me that opportunity to be able to cure it through, and I can now polish all this material together. So now that very clearly and simply shows you how to bond the crowns on top of the JUVORA frames. The secondary process with bonding would be, if I didn't already have the pink on here, I would be able to now do the same thing with the bonding liquid on the saddle of this material, then come back with my pink Gradia or pink Annexdent, any of the pink materials that are on the market for gingival aspect, and now I would by hand place that in those areas around the teeth and get a very natural effect of these crowns and bridges. At this point, I've got my processed PMMA case that I've put on top of my JUVORA framework, and it visibly is totally submerged in restorative material. But the great thing is now it's given this case strength and resiliency to where I know that I'll have great success with this product.